Hello, this is a really quick explanation of the results of the October 2023 Cost Pressure Survey run by Forum Central. Last year, in response to rising cost pressures, Forum Central wanted to evidence and illustrate how this is impacting on third sector organisations for health and care here in Leeds. We started to run a survey using a cross-section sample last September, and now we've widened that up to our whole membership. We run it quarterly, and we wanted to provide you with the results. It's for sharing with our ICB and council colleagues. Our third sector reps will use it with networks, meetings, and the population and care boards as well. We hope it helps to inform and evidence the third sector risks that are being faced at the moment. We also want our third sector organisations to use it with their trustees and senior teams. So I'm just going to run through the findings now. So the first question is, are you concerned your organisation is at risk of losing staff this autumn? And as we can see, nearly half, 45%, are saying yes, they're concerned about that. So that's really significant in terms of the risk to our staff and our workforce. The second question is looking at a reduction in services and whether organisations are concerned that that's at risk. And as you can see, that's 58.5%. So again, a significant number of the respondents, and we had 58 respondents to this survey, have said that that's a concern. Question 3 is, are you concerned your organisation is at risk of closing? And as you can see, we have 9.4%. That's 5 organisations have flagged that they're at risk of closing, with 3 concerned that they may be at risk of closing this autumn as a result of rising cost pressures. So those are the big headline questions. And then we're asking, in addition to that, have you had to reduce a service or close a service since September last year? And as you can see, 17 organisations have had to reduce services and 11 have had to close them. And about half of the respondents have said no, they've not had to make that change yet. The next question really helps us to understand how those risks relate to the ICB's population and care boards. And as you can see there, where there's the greatest risk for third sector services is with mental health, followed by long-term conditions, and then frailty and children. And then for question 6, we'd asked this time, we're very mindful of the rising demand that third sector organisations are facing. So we wanted to understand if you've had to operate a waiting list or simply not accept new service users for any of your services because of capacity. And as you can see, 48% have said they've had to operate a waiting list, and 20% have said they've not been able to accept new service users. We have 48% who've said that they still have capacity. So just to balance that off. And then we'd asked as part of that, if you are operating those waiting lists or you lack capacity, which population boards do those relate to? And again, we're sharing that with our representatives on those boards. As you can see, mental health is the highest, followed by children and people with a learning disability and neurodiversity. Those are of concern, obviously, because those are tend to be groups that are experiencing some of the greatest health inequalities anyway. So just to move on to the key summary points from the findings from the September 2023 survey, a chronic lack of uplifts on contracts has created a growing number of unsustainable services. And we have evidence of some organisations having to use reserves to subsidise their contracts and others losing staff to the public sector. The second point we wanted to make is that statutory service cuts are having an impact on the rising demand flowing through to third sector organisations, but that is resulting in demand from new users who cannot be safely or appropriately supported by third sector organisations. The third point we wanted to make is that this has a huge knock-on impact for health outcomes. So it's having an impact on third sector services, which are providing safe and warm homes, food, transport, benefits advice, and general wraparound support for vulnerable people. We're concerned that this inevitably translates into greater demand for high-cost, preventable unplanned care use and Leeds City Council crisis care as well. Finally, we're very mindful that third sector organisations' boards are being asked to take on a higher level of risk, whether that's using reserves, lowering pay scales, or reducing services. Boards are being asked to make decisions that they know will put business sustainability, staff levels, and service user wellbeing at risk, which is not a position any of them want to be in. We've provided at the end of the report just some examples of the quotes and feedback that have come through. So you can see that their concerns range from experiencing an increased demand from people who should not be attending our services as their needs are more significant. So this is a risk we're very keen to flag to our ICB and council partners. Concerns about what this means for vulnerable adults, concerns about what this means for services that are loss-making and therefore cannot be sustained in the future. And that organisations have had to reduce the support they provide to the families most in need. In terms of ensuring third sector organisation financial sustainability, we have examples of contracts which have had no uplift over 7 years. That organisations have had to dip into their reserves, fund pay rises through charities' reserves as well, and even subsidise contracts by approximately 15%. So this is all of concern and really immediate concern, but also for the long-term sustainability. So we have organisations that know that the way they're operating at the moment is not sustainable for the next financial year and beyond. We hope that provides you with a good quick run through of the findings and the implications of those findings. Please do share this. You can access this information and also information on the previous survey results. We're just flashing that up on the screen for you now. Yes, so our previous survey results are there. This page also has information on help for organisations and resources provided by third sector Leeds, the Council, Leeds Community Foundation and others. We also wanted to flag support for organisations in the third sector, particularly around workforce support through our HR network. Please do have a look at the information there for when the network is meeting, but also some of the resources that we've put together, which may be of use for individual organisations. And lastly, we wanted to flag our State of the Sector report, which is jointly produced with Voluntary Action Leeds on behalf of Third Sector Leeds. And that shows you the changes in our third sector composition, the broader third sector composition here in Leeds, from December 2020 data to December 2022 data. So please do feel free to look at that as well. Thanks so much for looking at this. We hope you find this information useful. Bye for now.